Hi everyone, this is our group project for Nursing 320 with Professor Callaway. We have chosen to do the vaccine debate. Our group members are Therese Molinari, Melody Cabral, and myself, Joanna Hopkins. We wanted to start with just a general introduction. What is a vaccine? A vaccine is defined as a product that produces immunity from a disease and can be administered through various methods. These methods include orally in the case of rotavirus or the OPV vaccine, through needle injections, intramuscularly, such as DTaP, hepatitis B, a majority of our routine vaccinations, also in a subcutaneous manner in the cases of measles or yellow fever. There is also an intradermal route for the BCG vaccine. The BCG vaccine not used in the United States, though if we are providing care to someone who may have been born outside of the United States, it's good to know if they had received this vaccination. And also intranasally in the case of some of the flu vaccines. Now, what is a vaccination? A vaccination can be defined as the injection of a killed or weakened organism that produces immunity in the body against that organism. Types of vaccines. According to the Centers for Disease Control, there are 28 types of vaccines available currently. Some come in combined preparations, such as the MMR, which protects against measles, mumps, and rubella. There are also single disease vaccines in the case of rotavirus. Now, there is some question and debate as to when the first vaccines were actually developed, but some of the first inoculations can actually be traced back to as early as the year 1000, when the ancient Chinese had exposed uninfected individuals with infected materials of persons with smallpox, either dermally by rubbing infected lesions on an uninfected person's skin, or by actually taking the infected material and making it a powder and inhaling it via intranasally. The name Edward Jenner kind of brings the forefront of modern day vaccines. And in 1794, Mr. Jenner had tested his hypothesis that exposure to the cowpox disease could actually prevent a smallpox infection. In his study, he actually exposed an 8-year-old boy with some lesion matter from a milk maiden who was infected with cowpox. He developed some minor symptoms, some malaise, fever, and had recovered within a few days. Subsequently, Mr. Jenner had exposed the same boy to smallpox lesions, and the boy was not infected with smallpox, leading him to believe that the exposure to cowpox actually had prevented him from being infected with smallpox. The debate to vaccinate. Mr. Dahl was quoted as saying, there is today something that parents can do to make sure that this sort of tragedy does not happen to a child of theirs. They can insist that their child is immunized against measles. I was unable to do that for Olivia in 1962 because in those days a reliable measles vaccine had not been discovered. Today, a good and safe vaccine is available to every family, and all you have to do is ask your doctor to administer it. Some of the salient points are that according to the Centers for Disease Control, infants are particularly vulnerable to infectious diseases, and it's critical to vaccinate them. By the age of 2, they need to be immunized against the 14 preventable diseases. These immunizations help prevent the spread of disease and protect them against the very dangerous complications of these now preventable diseases. What's the concern? Many parents who do not immunize their children feel that these medications directly cause autism, although there is no association between vaccines and autism. There are multiple reports and research-based evidence that vaccines do not cause this devastating disorder. the Centers for Disease Control have many reports and studies showing that there is a lack of correlation between vaccines and autism. We also have a link posted for an article related to measles, mumps, and rubella and the prevalence of autism and autistic spectrum disorders. Why are vaccines so important? Immunizations can save a child's life. Because of advances in medical science, the diseases that once killed thousands of children have been completely eradicated. An example of this would be polio. According to the Centers for Disease Control, polio has been eradicated since 1979, and they correlate the eradication to increased vaccination rates. A child with a vaccine-preventable disease can be kept from school and daycare, leading to impaired socialization, as well as obviously not having the ability to learn. The medical bills can be insurmountable, as well as long-term disability care. And needless to say, death can be devastating, especially if it's a loved one or your own child. Some people are unaware as to how to go about getting vaccinated. And according to the United States Census Bureau, in 2013, 7.6% of children under the age of 19 were uninsured. The emergency departments in our hospitals have become great resources for our unvaccinated and undervaccinated children. Many of the emergency rooms are now asking immunization histories as part of the triage process and are able to provide the vaccines, situation permitting. Also, many schools and school districts are trying to develop programs in order to provide vaccines for little or no cost for their students. Many local pharmacies are also now providing little or no cost vaccines for the general public. Primary care providers obviously are a great resource, as well as the community health clinics, and they both can provide vaccines for children, as well as follow-up care and the education that some parents may need with regards to vaccines. Some communities are actually investing in mobile vaccine clinics in which the vaccines are actually going into the community, and the people who cannot access a physician or get to a clinic have the ability to bring their child to receive their vaccines. And vaccines are safe. All vaccines are safe and effective and are only given to children after research and evidence-based testing, as well as FDA approval. The FDA approval process can take anywhere from 10, 15, 20 years to actually get approval to be marketed for the public. These vaccines have been tested for many years and are reviewed by doctors, scientists, healthcare professionals, and the FDA grants the approval for them to be used. And finally, there are no links to autism, and vaccines are safe. On the other hand, there's a quote here from Mahatma Gandhi with regards to vaccines. And some of the cons of vaccinations. Vaccines are required by law for children to attend school and receive an education. A parent may decline vaccines for religious reasons, but what if the parent just does not agree with vaccinations? What are the cons to vaccinating children? With anything, there's a risk for side effects or adverse reactions, such as infection at the injection site, anaphylaxis. An example would be the rotavirus vaccine can also cause intussusception. There's a risk for Guillain-Barré syndrome, in which the immune system attacks the peripheral nervous system, leading to weakness and tingling in the legs. There is no cure for Guillain-Barré syndrome, and it may recur at any point throughout the lifespan. Now, there's been a lot of controversy related to the components of vaccines, namely thimerosal, which is a mercury used to preserve the vaccine. Some of the adverse effects associated with thimerosal are an increased risk in neurodevelopmental disorders, leading to an increased risk for autism, speech disorders, mental retardation, and infantile spasms. Thimerosal was found in the 1990s in DTaP and Hib vaccines, and currently in the 2000s is only being used in multi-dose vials of the influenza vaccine. The CDC also reports that aluminum salts, sugars, gelatin, egg protein, and residual formaldehyde and neomycin are found within vaccines, which makes a lot of people uncomfortable with regards to the fact that they're injecting their child with aluminum and formaldehyde, as well as other chemicals, metals. And many manufacturers actually started to remove thimerosal from their vaccines. But while the CDC is denying any adverse effects related to thimerosal, and the manufacturers stopped using it, why is that? This slide discusses active and passive immunity, and vaccines are generally given to prevent illness and build antibodies for a potential illness or disease. Vaccines are considered active immunity, but often a booster is needed after a blood titer is drawn if a person is not immune to a disease such as measles, mumps, rubella, varicella, or hepatitis B. You'll note in the right-hand corner there's a photograph, and it says that almost all vaccines wear off in 5 to 10 years, stating that unvaccinated children pose no greater risk to society than adults with a full childhood vaccine history. Essentially, this is saying that within 5 to 10 years, when somebody loses their immunity and needs a booster shot, doesn't follow up, it's essentially the same as being unvaccinated. Now, passive immunity, typically we think of as a mother passing on to her newborn baby. There's also herd immunity, which is when the community or household around the child is vaccinated as a protection for the unvaccinated child. This could be because the vaccine is contraindicated, because for religious reasons, or the family just chooses not to vaccinate the child. This slide discusses the outbreak of measles in 2014. There were 23 separate outbreaks with a total of 644 cases across 27 states. With regards to the measles, of the 644 cases, the CDC reported that a majority of the affected individuals were actually Amish, unvaccinated persons in Ohio. For the other cases, it was just reported that they were unvaccinated or they needed a booster shot. This slide is kind of interesting, that the total deaths in the United States during the past 10 years, from 2004 to 2015, there are 0 deaths due to the measles virus itself, but 108 deaths related to the measles vaccine. This slide reverts back to vaccines and the correlation to autism. And it's a controversy that has been going on for years and will continue for years to come. In 1970, you can see that the cases of autism were 1 in 10,000, with a steady increase. In 2013, 1 in 50 children was diagnosed as being on the autistic spectrum. In 1998, Dr. Andrew Wakefield, who is a British gastroenterologist, had made a correlation between the MMR vaccine and autism. And he actually had come up with the leaky gut etiology and hypothesis with regards to children who actually developed diarrhea as well as autistic regression directly related to MMR vaccines. Now, the VAERS is the Vaccine Adverse Event Reporting System, and it's a national reporting system for the safety of vaccines and monitoring of adverse reactions. VAERS collects the data and analyzes it related to any adverse events reported that follow vaccinations. This is a graph made up seeking the years from January of 2010 until April of 2015, showing any adverse reaction that was reported, ranging from not serious to either life-threatening and death. And you'll see there's some disconcerting data related to children under the age of 6 months. Now, to be more specific, an example of Gardasil, which was one of the newer vaccines, that in 2006, the vaccine Gardasil was introduced in attempts to decrease human papillomavirus, or HPV, in young females. The recommended age ranges for the vaccination were from ages 9 to 26. And since 2006, VAERS has received more than 18,000 reports of adverse side effects related to Gardasil. The reports include Guillain-Barré, lupus, seizures, paralysis, blood clots, brain inflammation, severe fatigue and weakness, heart problems, shortness of breath, chest pain, and many more. Another article had reported that from 2006 through May 13th of 2013, there were 136 reports of death related to Gardasil. There's also ongoing debate related to infertility. And since 2006, there has been a 790% increase in reported infertility related to Gardasil. There's also increased risk for acute disseminated encephalomyelitis. And some people just have concern that it's promoting sexual activity and reckless behavior, because you're telling an adolescent or pre-adolescent that they are now immune to HPV. Sometimes they can't grasp the concept that they're still not immune to other STDs. Now, with regards to the cons of immunization, if parents are making an educated decision and feel that they do not want to vaccinate their child, we should be able to respect that. We have the ability to respect an adult's decision that they don't want to continue treatment for cancer. Why can we not accept that an adult does not want to vaccinate their children?